Sanjeev, can you tell us a little bit about yourself, your background, what are your interests, and what is going on with you and quarantines, public health, and so forth?
Thank you, Randall. This is the second time we're having a chat. It's great to be with you again. This is one of those areas where very few people are really interested because there's so many topical things going on in the world regarding COVID. Some people are talking about COVID, the COVID inquiries. I think I've moved on from all of these, and the reason is that. So you asked about my background. My background is basically I'm an economist and formerly senior civil servant in India. I worked as an economist in Australia, and then I resigned because I didn't agree with the policies of the government, and they asked me to remove my tweets and other social media comments, and I said no, goodbye. I'm going to go out and fight you publicly, which is what I've been doing. I also contested the elections, both the parliamentary and the local election, basically to educate the community. I spent a lot of money on that, but that's okay. Nothing really changed because the people are not really interested. They're completely fear-stricken. It's not just the people, it's also the doctors. And that's one of the things that I've sort of come to. But the point about all this, Randall, is that by the end of 2022, by the middle and end of 2022, because initially I was focused on COVID and all these issues, lockdowns and mandates and other things. And I was writing a lot about it. I wrote cost-benefit analysis with G.G. Foster, published my own book so I published effectively 2 books, and probably tens and tens of articles in my Times of India blog, and also in the Australian, the Financial Review of Australia, and the Spectator and other things. So I was writing a lot. Then I decided this is not working because I wasn't really aware. It's been a bit of a a blind spot in my knowledge set, which is we are all very ignorant people. And so suddenly I realized that people are telling me that this has been happening in the past. And you're one of them, and there are many others, and that this has been a pattern in human history. And as I look back and I realized that, look, there's something going on here which we haven't understood properly. And so the whole scope of public health is up for grabs. I looked around to see if has anyone from the economics perspective considered public health as a policy area from first principles. Now, what do we mean by that? Because, in the Treasury, I've been doing a lot of first principles work. That's been my job, to look at a policy area, really starting from the question that what would happen if there was no government? So we always start with the question, what will happen? And then what is the problem with that? Is there a real issue with that? And can you do better as a government and so on? So those are the first principles questions. Mm-hmm. And we do that for almost every single policy area. But for some reason, I had not thought of public health. I was in the Treasury, I wasn't looking after public health. That's probably one reason. But then I looked around and found that there is not a single first principles review of public health in human history. Now, that's a big claim, but it's true. I've by now looked at hundreds and hundreds of textbooks on public health and, by economists, by others, and so on. Journal articles. Not a single person has actually asked the question, why do we have public health? And really, what is its scope? And what is the real problem? What are we trying to address? So the issue became for me that I need to spend some time to study this. And so I started writing about this in the end of December, that we really don't need public health. We need to really dismantle the whole thing into its little components, work out where the private health can, and private enterprise and people can manage on their own, and where exactly is the role for government and what exactly is the role. So we need to really be very untangle the whole thing. Is becoming like a hydra, hydra-headed monster.
Hydra. Yep.
It's becoming like it's taking over tentacles everywhere. It's gone to obesity. It's gone into now climate change. It's gone into social justice. It's gone into every single part of our life. And what is the common theme? Public health believes that they have some inborn natural right to the bodies of other human beings. And so, just because you're a public health person, then assumption is that I'm better than them and I can therefore, control them. Mm-hmm. And that I think is, to me, a very disturbing situation. So I've been stepping back and looking at that and saying, where does this come from? And interestingly, as I look back and I found there's there's an economist who started the whole thing, and he's not widely regarded by many people as a great economist. Jeremy Bentham. I consider him as a very good economist. Many people have misunderstood what he said because they haven't read his works, and they make assumptions about what he says and what he means. I hear all sort of criticisms of utilitarianism by people who have not read his work. Okay, so it just amazes me how easy it is to criticize others without understanding them. But Bentham actually was against government intervention. However, he recognized pretty much in the late 18th century, in fact, and early 19th century, of course, when he published his main works, that there is the kind of a problem going on with the community's health, and that the health is causing us poverty, and therefore there is a need for the government to do something about it. Basically, he recognized the negative externalities, what we would call negative externalities. And he, of course, was the person who advocated, he didn't really call it a cost-benefit analysis, but he talked about, the greater good of the greatest numbers, which is basically the same thing. And so he was effectively the founder of the concept of cost-benefit analysis. He also, by the way, interestingly, was pretty good at marginal analysis. Now, we say that marginal analysis came in economics towards the end of the 19th century, but if you look at Bentham, he actually had that in his mind already. So he was a very good economist, given his time. And so what he did is he recognized that there is a role for the government in the community's health, and that's something which we agree upon. There is a role. And then he was basically talking about two areas. He also, by the way, talked about quarantine. I'll come to that, but he's talking about essentially. He was also in favor of quarantine, from what I can see from his constitutional code. Although I'll come to that a little bit more in detail about how we really don't know what his views finally were, because he was very closely associated with those people who opposed quarantine. Nevertheless, his constitution code, which is published in the 1820s and 1830s, particularly early 1830s, is where he talks about the role for the government. He has the ministers. Okay, so he creates a new cabinet system. He creates a new constitutional system for the UK government, and it was more or less followed. Interestingly speaking, almost everything that he said has actually been implemented. And so what he says is that you need a minister for sanitation, and you need a minister for health, and you need a minister for water. And the minister for sanitation should also look after quarantine. Now, that's the only little instance I've seen about his mention of quarantine. However, there were people working with him very closely. Southwood Smith, and first it was Southwood Smith, and then it was Edwin Chadwick, who were followers of another guy, and that his name is Charles Maclean. Charles Maclean is, in my view, the founder of public health. He should be called the founder of public health, along with Jeremy Bentham, because Charles Maclean was one of the most systematic analysts that I've come across in my life. Given his time, okay, he had a lot of issues, obviously, given his relative ignorance of those days on the causes of disease. What he did was he systematically studied quarantine. He has written a number of books, and luckily for me and for the world, they're available in the public domain. And in his books, he looks at the empirical evidence and concludes that quarantines have caused far greater harm than any benefit. They've also aggravated the disease in almost every single case, particularly with the plague and other things. So his conclusions were so powerful that his followers included the main founders of what we call public health, namely Chadwick and Southwood Smith, who were members of the Board of Health and contributed to the big reforms in public health in the UK, which were then also taken over in the USA. Now, USA was slightly independent, but they were very much in touch with each other. The contributions of the thinkers were going. Charles Maclean was very influential in the USA as well. So what I've studied a bit of that, and then I concluded that quarantine was actually the main thing that drove the sanitarians. They were continuously asking. That's why my thing says sanitarians versus quarantinians. This is a word I've cooked up, quarantinians, because the people who support lockdowns are actually quarantinians. They still believe the theory of quarantine, which is basically you isolate the healthy people. So it's quite a different thing from isolation, which is of the sick, which is something I agree with. But for isolating the healthy people is the issue. And that's what the sanitarians said, look, we will make sure that most of the diseases are dramatically reduced through sanitation. And the idea of quarantine is both very dangerous, harmful. I mean, all sorts of words have been used, strong words against quarantine have been used by the founders of public health. This was one of the main reasons why there were inquiries on the against quarantines. But and of course, the quarantine was reduced, was pulled back quite strongly as a result of this pushback from the sanitarians. However, the forces of economic strategic warfare, basically one country versus the other. So, if you impose quarantine and the other one doesn't, or sorry, if you don't and somebody else does, then there's a problem in trade. You can't really trade with each other because there are all sort of rules that come in the way. So then the lowest common denominator is, okay, let's all do quarantine. So there was a kind of sanitary conference, went on, I think 7 or 8 of them in the late 19th century, starting from the mid 19th century. And finally, they did agree to some kind of an international thing, initially with mainly Europe, but then internationally. And then the WHO came on and took on from there. So the idea was that politically and internationally, as part of international trade, quarantine could not be eliminated, right? However, there was a very strong background in the 19th century, a vast amount of literature against quarantine. Now, the problem with this whole business of quarantine, and the public health literature. So, sorry, Randall, one of the big issues I found in public health literature is that it actively promotes quarantine, okay, including economics textbooks, health economics, etc. So, the quarantine is considered in a positive, is cited in a very positive light in virtually every single book that I've read, and I'm trying my best to list as many of those as possible, but there's just too many of them. So the students of public health, when they come out from their college or whatever, they have managed to get a kind of a latent indoctrination that quarantine actually worked. It worked for the plague, it worked for this, it worked for that, it worked for Spanish flu, it worked for everything. So what then happens is that we cannot then claim, like Stephen Barral claims, that there was no lockdown lecture. Yes, there was no lockdown lecture for doctors when they're training, but there was a lot of subliminal indoctrination through these little positive comments about quarantine in public health history textbooks and so on. So the other thing that has happened is public health has more or less completely cancelled Charles Maclean. So Charles Maclean was found in virtually every single journal, in the medical journals. There was debates in the newspapers, in the parliament. He was highly praised in the parliament, etc., etc. And then today, all we hear about Charles Maclean is incidental. And I have actually come across him through those incidental comments, where he is condemned for being an anti-contagionist. Okay, so what happens is that Charles Maclean was very, very clear that smallpox, measles, and a few other diseases are completely contagious. He repeatedly mentions everywhere that he is a believer in contagion where he sees it. Where he does not see it is things like the plague, cholera, where he says that, and that is absolutely correct. So the thing with these things is that they're not person-to-person contagious, okay? So yes, the plague is if it's pneumonic and so on. So he's not 100% correct there. But these are diseases which are actually carried through vectors or through the waste on water, like with cholera. So what happens is that he was absolutely right in his deduction. And what these guys have done, they have blacklisted him as an anti-contagionist, saying that he doesn't believe in contagion. Well, there is actually no contagion for plague and so on, right? So what has happened is some kind of a bias has crept into public health among the writers, particularly in the 20th century. So in the 19th century, there's a lot of positive commentary on Charles Maclean. And by the 20th century, we start seeing him being condemned and so on. So I don't know at the moment, I'm not going into details of why. But what we see is that the foundational the founders of public health, were believers in sanitation and clean water. Now, Edwin Chadwick has a problem. He doesn't understand what's inside the water, right? He wants clean water. He writes about it everywhere. He doesn't realize. But the other thing that people condemn Chadwick, and this is one of the things I found, which is very interesting, because again, people haven't read Chadwick. And I've been buying every single book that I can about Chadwick. For example, this one is a PhD on Chadwick by, and there's another one here. This is The Health of Nations. This is a book of, by Chadwick's work. This is quite a chunky piece of work, okay? Chadwick's original writings. And so what happens here is people are complaining, and in the literature, public health literature, that Chadwick dumped the waste from the sewers into the Thames River, right? And so they say this guy was really a stupid guy. Well, number one, this was happening from around 1810 or 1805 or 1806. So I've documented the history of that quite clearly. Second, he was again and again writing, from 1842 onwards, he insisted that you separate these two out. And where should the sewage go? He had major writings on that. In his books is full of that, okay? What does he want? He wants the sewage to go into an area like where it's cleaned up, and the manure is taken out from the sewage and is used for growing crops and other things. He's against the idea of dumping human waste into the river. He's against it. But what happens? He's overruled by all the engineers, etc. And now, because of the fact that he's overruled, and therefore during his cholera plague, that when he allowed this to apparently go into the Thames, that the cholera was not stopped, he is now being blamed for being a guy who dumps the human waste into the Thames. But he's the founder of the theory that it should not go into the Thames.
Yeah.
And today, all of us everywhere in the world make sure that sewage goes into the land, it's cleared by oxidation, etc., and the manure is used, the bio waste is used for growing crops. That's what happens in Melbourne, for example. I'm sure it happens everywhere. So Chadwick was the founder, and by the way, his book is amazing in terms of the details into which he goes in terms of describing how sanitation should work and so on. So what I find is that the great sanitarians, and of course, Jeremy Bentham himself. So think of Charles Maclean, think of Chadwick, and of course, Bentham. All these three are being condemned in the literature of public health. Okay. Ethicists, a lot of ethicists, so-called, they condemn Bentham and his utilitarianism. Apparently, he's so stupid. Well, if you only did a cost-benefit analysis, you would realize that he's actually wanting the minimum intervention by the government, to achieve the maximum good. So I think what has happened is a lot of ignorance has been found in the public health literature, which is one of the main things that I'm trying to fix. So the paper one that he just I think he showed a slide from that. The paper one is really the one quarantinians, sanitarians, and so on. So that one actually conclusively ends by saying quarantines have never worked the last 650 years, and I go and study this in great detail in terms of the Spanish flu as well, where there were a couple of cases in some islands where it so-called did work. But then that's not typical of these things, right? In almost all cases, these things cannot work. And what are the reasons? And the reasons are cited by Charles Maclean himself. So Charles Maclean actually talks about human factors, that, humans will somehow defeat the thing. Now, they do it deliberately or accidentally, they will defeat the quarantine. So don't do it, because it's not effective. It's not really doing what it's supposed to do. It'll actually worsen the health of people who are quarantined, and so on. So that is my first paper, which I think is very clear. I have absolutely no doubt about it, that this is the correct position. And so public health needs to, recognize Charles Maclean, needs to understand utilitarianism, and particularly the concept of cost-benefit analysis, the minimum intervention by government in order to achieve the maximum good, et cetera, et cetera. So they're simply not good at that at the moment. And I don't think ethicists really have read anything worthwhile. To me, it sounds, I was reading the thing called libertarian work. I don't know whether you know what the libertarians are. Libertarians are theorists who talk about, self-ownership and blah, blah. And, they create this mythologies about the world, rights and other things in which they live. And Bentham, by the way, radically opposed the idea of natural rights and so on. So he said, this is all created by the government. There is nothing like inborn, etc., which is true. You don't have inborn rights. You actually are given those rights by the government because that's how you have contracted and worked out the situation. So nevertheless, leaving aside the debate, the problem I'm alluding to is words. If you read the ethics literature and you read the libertarian literature, you find them creating new words, new concepts, and fighting with each other on those words. It's like philosophy became a completely puerile and useless discipline for humanity, and therefore we finally moved into things like economics or sociology or whatever. We got out of it this concept of economics, of philosophy, which was basically becoming quite useless to mankind. It was not helping out, and physics came out of it, and everything came out of it. And the residue of rubbish remains back in philosophy. I'm not saying it's rubbish, by the way, but more or less it's all words, which mean nothing. So likewise, there's a lot of those things happening in ethics. So public health ethics is completely worthless. And I believe they should spend more time studying the real science. They should do empiricism, which is what I talk about. That, look at the actual performance of lockdowns, of quarantine. Mm-hmm. Go into detail, study this thing carefully.
The problem often is that the people doing the looking are looking where they want to look.
That's also true. Which is
and then even if two people see the same thing, if one person being paid to look at it a certain way, they're going to have different conclusions.
Well, Randall, this is the way science evolves. Unfortunately, science is full of personal interests and other things as well. So what I'm doing is I'm not expecting to be even slightly budging this huge Titanic of public health. It's going its own way, basically a communist kind of way, take over society, control everybody, etc., etc. I don't think this is going to budge it, but that's my recommendation. Look, I'm entitled to my view, right? And others can have a think about it. So I do believe that ethicists should shut down their discipline. It's completely pointless and useless. I agree with bioethics to the extent we're talking about medical ethics. See, there's a big difference between medical ethics, which is about how you treat the human being and informed consent and whatnot. I fully agree with that. You do need to have that. And you do need to have ethics approval for doing experiments with people and other things. That's all fine. When you start doing ethical analysis of public health, the global health of the society, you can go wrong by orders of magnitude, unimaginably wrong. So which is what they have. Most of them have gone extraordinarily wrong. And many of them promote quarantine. They promote quarantine, they promote lockdowns, they promote vaccine mandates. Not all of them, but many of them. So ethicists are absolutely as useless as libertarians, who also have this tendency to generalize based on few words and therefore conclude certain things without even looking at the actual analysis of the thing, cost, benefit, etc., etc.
Yeah, no, I think you're onto something there. I've had a lot of thoughts percolate. First of all, I work with brownstone.org, and Jeffrey Tucker is the inspiration, the leader, and the great writer, and libertarian by nature, I think, and by temperament and by history. But he's somewhat given up on a lot of the libertarians because they abandoned the first half of their name, the liberty part, during COVID. And a lot of the prominent libertarians of Reason magazine or Reason whatever they are, and a lot of his favorites, leading lights and so forth, kind of buckled, and tripling masks outdoors and whatnot. And
yes.
So humans have had at various points of luxury the ability to philosophize. I'm not sure. I think that maybe the cavemen surely thereafter had the same mind potentially as us and the same possibilities, but they didn't have the feasibility. When they're worrying about spider bites and freezing and getting enough food and spending all day building one piece of leather clothing or whatever, to philosophize. Now we do, but at root though we are still animals, and we have this basic fear. And I think that the essence of all of this is how fear can be all encompassing. Obviously the cavemen, they're fearful of freezing and whatnot. They can't philosophize. And now we've kind of devolved away from philosophizing, even though we have the luxuries of 10, 15, 20, 50, or 100 years ago. We have gotten into kind of a pandemic of closed-mindedness and safetyism. And, it seems to have kind of short-circuited the philosophic pathway, and people are going to, they're kind of grasping at straws. They're going to more medieval techniques that have not been proven. And frankly, this is the essence of my current article on Dr. Fauci and his consultation with Donald McNeil, the New York Times. And it was really the seminal article in February 2020 that, set the United States backwards, into lockdowns. The article is literally titled "The Coronavirus: Go Medieval on It," and I'm happy to show you the page if I can pull it up while we're talking. But this concept of avoiding the modern contrivances and knowledge and so forth, and just getting out your anger and aggression. I think people have had a lot of free form aggression and so forth. As we've kind of left classical religion, we've adopted these, more primitive versions. It's not like we can't, I think we're a religious being and we're an animal being, and we have our fears and whatnot, and they get manifested different ways. And we kind of have more of a group dynamic in social media and the World Wide Web and so forth. And we're schooling, but not in a useful Kantian, knowledgeable kind of way. We're schooling like fish. The way fish school, they all just kind of follow each other, simultaneously going one direction or another. And even lemmings were mischaracterized as jumping off cliffs together. But I think we are in some ways doing worse than that. And that's there's not much of a question there. But I will come up with a question for you. You can deal with anything I just said. But maybe we can talk about the essence of quarantine itself. I know it's from the Italian word quarente, which is 40, and I assume it has to do with 40 days. Now, what was the root of that, and as far as illness goes, and how did it catch on as a term?
Well, there's plenty of literature on that, and I think there are the conflicting dates about the origin of the concept of quarantine. The naming came later, but that's the 40-day thing. But the initial idea was that, look, it's a kind of social distancing. We think that we're getting this plague from outside, and so we don't want ships on our borders to come in without being checked for, the carrying plague or whatever. So the initial concept started with the hypothesis. Remember, there was no idea about the rats and other things or bacteria and nothing. So all that was available, and I don't blame them for that, because at that time, that was the most plausible hypothesis, that here's some new disease that's come into our city, and maybe it's come from outside, and maybe the ships are bringing it. So it started with the marine quarantines, and that continued with the marine quarantines still continue in many parts. And in fact, in my paper, I still recommend one exception of a marine quarantine in a few cases. So I'll come to that, but that's a very special case. But even with the latest science, I would say that will be required in a couple of small cases. But leaving that aside, the broad quarantine, which is then moves into things like the next. So the many types of quarantine. So the first thing is it starts in a kind of a defensive strategy. The naming, etc., the number of days changes. Each country has its own number of days and other things and so on. So it's somewhere around the essentially the Mediterranean. That's when it starts.
And what year was that?
It starts in the 1340s. So my recollection at the moment is not, I've not been reading it for a number of weeks now. It's about 1340s, and so I would say roughly 650 years ago is my roughly 650 years ago is when it starts, and it fails in almost all cases. Now, the word fail is when a quarantine, you can have all these barriers, but the disease comes nevertheless. And so the plague continues and comes from all directions and angles, and comes via the land. I mean, imagine a rat. Now, rats don't travel too much in their lifetime, but they, incrementally over generations, they can move across borders. Land borders are very porous, so nobody really knows. And I think that's my understanding. No one really knows from where the plague came. They're still trying to figure out, scientists, and no one, I think it's mostly a bubonic plague. That's what most scientists are claiming. And that's the way it has come through some rats. Now, the rats can travel by ship, of course, very easily. They enter the, areas of they're carrying the cargo, but they also go over land. So essentially, all kinds of weird things have happened in the past. And of course, the quarantine, what it led to, and that's where I am really interested in tapping your brain, is over the course of many months of reading this and that, I realized that the common theme. So I'm looking at patterns here, Randall. I'm looking at patterns across history of human behavior and response. One of the things that I found is that the doctors, and by the way, there were very few doctors in the past. Doctors became more common only about 300 years ago. So, but doctors were the first to panic. It seems to me very strange that, but then it is not strange. The more I thought about it, I said, if I'm a doctor, how would I feel? So here is a disease that can kill very badly. Now, there are some brave doctors like Clot, what's his full name? I forget now. He's a French doctor who's a very senior French doctor in the times of Napoleon. And this guy actually says, I don't agree this is contagious. I will take the pus from the bubus, whatever it's called, put it into my body. And he did that, and many other doctors and didn't catch it. And it doesn't travel that way. Okay, so now I'm curious about that, why it doesn't. And most likely that means it's pus. It's not really the active bacteria. Whereas with smallpox, you can actually catch it very easily that way. And that was recognized by Maclean and others. But with the plague, you can't even catch it that way. It's quite difficult to catch the plague. But the general point, I guess, I lost track of what I was saying. So the general point is that the panic. Yeah, the general point about this thing was that if I'm a doctor and I think that it can be, I can catch it by touching or going close to others, then I, as a doctor, well, I'm worried about my own life first. So I will not go. So what I found is doctors fled. So the vast majority of doctors, in all cases, virtually all unique, there's virtually no plague, reported plague in which the doctors did not flee. Okay. So the other was that the doctors would send somebody else to get a report on the patient, and then they would so-called prescribe whatever medicine. So then I said, okay, then what about recent pandemics? In recent pandemics, I've seen the same pattern with Ebola, for example, in West Africa. We find the same pattern that the doctors have fled. There is nobody. There's one volunteer doctor from USA who is a brave guy who goes inside and does a lot of work, and he's writing about it, saying, "I'm the only guy left in this entire place. All the local doctors have fled." So the first thing I noticed is doctors flee. The other is examples in Canada and in Taiwan. With the SARS, what happened is they shut down the doctor. They basically shut down the hospital and kicked out everybody else. They said, this is now quarantined. Okay. Now anybody inside is also quarantined. You can't get out, all the medical staff. Nobody else can come in, and we're not taking any more patients. So what are we seeing here? We're seeing medical panic. So that's my second paper, if you can pull it up, which talks about medical panic. What is my hypothesis here is that we know that for sure, right, as you were describing correctly, there's a lot of panic. And you also mentioned Anthony Fauci's panic of the 20th of February. And by the way, I think on the 16th of February, he wrote a non-panicky article as well, which I've also cited somewhere. I haven't seen this particular one, but I know for sure that the doctors panicked first. And I've got evidence from a number of letters written by doctors in Australia. I think 5,000 or 6,000 doctors in Australia wrote to the Prime Minister demanding lockdowns. And so we see that, so who's the most influential? My guess, even with Boris Johnson and others, is that he himself was probably not so panicked. But when he realized that the NHS system will collapse, the doctors are pressing him. And remember, doctors are very influential. They have contacts everywhere, right? And so if doctors are starting to panic, they're going to demand, shut down the hospital. I don't want anybody there. In fact, that's what happened with the aged care as well. I was reading recently a paper which said that all the elderly people in the hospitals were driven into the nursing homes, regardless of their carrying COVID or not. So the first thing we notice is the medical panic. And that's the question I have for you. So my hypothesis is that doctors panic. And by the way, there's a very good reason. There are many, many good reasons for doctors panic. One, they know that the system is not capable of dealing with this problem. Okay, the system is always running at the very margin. It's completely efficient. So economists have made sure that the health system is very efficient. What is efficient? Is just in time. You have just that many staff, that many facilities, that many rooms, that many whatever, just to deal with the marginal thing. And so you cut down the ICUs, you keep cutting down the facilities, you remove all spare capacity, and make sure that everything is efficient. And what happens? The doctors know that there is no capacity. And they also know that many of them will go on sick leave immediately. And that's what happens. 20% of them roughly disappear within days of any pandemic. Okay. So doctors know that there's no one to take care. They also know that there's not sufficient PPE. Now, I'm not saying PPE is a great thing, but I know that there are some PPE which is critically important, and that's missing. So we know that doctors have a good reason, that they are the front line. Okay, they are the guys who are going to die first. They know very well, and many have died in the COVID as well. Many doctors did die. So when that is the case, and so my argument there is, if doctors are genuinely in panic, and they are in panic, we've seen throughout history, what can be done to reduce their panic? Because if the doctors panic, then the whole society panics, because all the signal that they're telling is the health system cannot deal with this, so let's shut down, let's stop everybody. That is the typical response. Now, and of course, shut down the borders and everything. So that's why I then came out with the third paper, which is the isolation hospitals. So I'm saying, my understanding from, if my medical panic theory is correct, because I don't believe that the general panic will occur if the doctors are not panicked. And I've got a very good counterexample for that. Anders Tegnell did not panic.
That's Sweden.
When a doctor at the top does not panic, the society remains very calm. You can look at the videos of people in April, May, June in 2020 in Sweden, happily going about their normal day-to-day business. No panic whatsoever. Of course, some of them were working from home and all those good things, whatever, were recommended. But there was no panic. Whereas if you look at any other country, there are panic everywhere. By the way, in Sweden, there were a few doctors, about 10% of them, who did panic. But the vast majority did not, because Tegnell at the top was saying, this model is of in Imperial College is basically crap. He said it politely. He said, we have a standard, well-planned strategy for such things, and we're going to follow that. We have sufficient capacity. We'll build a little bit of few extra ICUs. And so he sent out, and you watch him carefully on the television. He is the most calm fellow on earth. Anders Tegnell is radiating peace, calm, control, and so on. You start looking at people in the USA and Australia and others, my God, they are soaking with panic. Their television broadcast, their commentary, their everything being exaggerated. And so if the doctors will panic, then my hypothesis is that then the public will panic. So it's not the public panic drives the doctors panic.
So I'm with you to a point. I apologize, but I spent the last week or two working on a paper on Dr. Fauci. And so I've kind of done, I don't think I can compare it to your deep dive, because I think you're amazing in your breadth of knowledge and your depth and the way you attack a subject. But I have been working on Dr. Fauci, and in his defense, I mean, I think there are actually two Dr. Faucis. There's, it's almost like Jekyll and Hyde.
Jekyll and Hyde, yeah. Absolutely right. Good point. I like that word, Jekyll and Hyde.
Yes. There's a Jim Carrey movie. I think it's called Liar Liar. Hilarious movie. It's one of these things where you get bitten by a poisonous some spider or whatever. All of a sudden or lightning. Maybe it's all these movies that have lightning or something like that, and you've changed. In this case, he has to, I think, always tell the truth, which is not always useful. If you're on a date or something like that. Does this dress make me look fat? Well, no, you're fat to begin. Anyway, so there are I do think there are two Dr. Fauci's. I think there's just regular old, using his medical knowledge, Dr. Fauci, who's a smart enough guy. Yes. I think he did well in school. I think he paid attention. I think he's sort of a workaholic. And as far as bureaucrats go, and they don't have to be, he's relatively diligent, because I think they get paid the same whether they produce or not. And he has political skills and so forth. He doesn't necessarily have to produce. So I give him credit. I think he's a smart guy. He went to, I think, Holy Cross and then maybe Cornell Medical School. But I think remembering he had honors. He's a smart guy. And so when he's asked things in February, like mid-February 2020, should we worry about coronavirus? He said, it's just minuscule.
Absolutely. Exactly. He says that in writing. Minuscule. Yes, he has got a paper on that.
Dr. Fauci. And in 2004, when he was asked about getting a flu shot after you've had the flu, I trot out my Dr. Fauci. I apologize, but he's like, well, there's basically no reason to get a flu shot after you've had the illness because you have full immunity. Why would you want a vaccine against one antigen when you've experienced the entirety of the virion of the virus? And so there's no point. So there's honest Dr. Fauci. There's, correct medical student Dr. Fauci. And then there's this other guy who, smells the barbecue or something like that and abandons his party for the one next door. And I think there's some aspect where he was turned, but for whatever reason, I think he got a better idea, or he saw this as a tool for political gain. And that's the essence of my article. This is a little bit of a preview, perhaps, but I can put up just a tiny bit of it. And I don't want to spend too much time on it, but basically it's Dr. Fauci's own gain of function that, he had a gain of function, in advance of what he should have. And he did, some things that didn't make sense. I have here Fauci's medieval turn. And this is quoting from an article in the New York Times from which Donald McNeil used as one of his primary sources, Dr. Fauci. He was on the fence whether he should print this article to go, to take on the coronavirus, go medieval on it. But basically, it was Dr. Fauci's kind of deciding vote, or his thumbs up, that McNeil took to heart most. And it was McNeil's medieval rationale was based on Dr. Fauci's recommendation. So what is it literally to go medieval on something? So this is from the McNeil article. There are two ways to fight epidemics: the medieval and the modern. The modern way is to surrender to the powers of the pathogens. So I think this actually goes to a lot of what you're saying with Chadwick and so forth. They acknowledge that they are unstoppable and try to soften the blow with 20th century inventions, including new vaccines, antibiotics, hospital ventilators, thermal cameras, etc., which is our version of, kind of sanitation, public health. And the medieval way, inherited from the era of the Black Death, is brutal. Close the borders, quarantine the ships, pen terrifying citizens up inside their poisoned cities. For the first time in more than a century, the world has chosen to confront a new terrifying virus with the iron fist instead of the latex glove. This is McNeil writing in February 2020, not 1920, not 1820, not 1320. Although maybe it should have been 1420, somewhere around there. And so, here, this is my article, but in pushing the medieval approach, Fauci signaled alignment with China's authoritarian response, and so forth. And the irony is that McNeil himself in 2009, younger and wiser, perhaps in the opposite direction, wrote here, whose fault was the Black Death? In medieval Europe, Jews were blamed so often and so viciously that it's surprising it was not called the Jewish death. During the pandemic's peak in Europe from 1348 to 1351, more than 200 Jewish communities were wiped out, their inhabitants accused of spreading contagion or poisoning wells. Now, they weren't just wiped out. They were brutally, we all have heard of the Holocaust, but the Holocaust literally means to burn altogether. So if you want to think of the literal Holocaust, this was happening, certain places like Mainz, Germany, wasn't Germany at that time, but what is now Germany, Erfurt. They were closed into their synagogues. The doors were barricaded shut, and the whole place was burned in hopes of getting rid of the Black Death. It was a Black Death, mind you, by the time the charred remains were either attended to or not. But that was the actual Black Death in this case. But to go medieval on something, so in 2009, he points this out, how brutal it is to go medieval on something. And then in 2020, he's like recommending it, the iron fist, not the latex glove. Now, which is a more modern conception? I don't use latex gloves that much, but, certain times you want to, you want to do a certain type of, examination on people, you want a latex glove. It's nice things to have. I don't wear one today. I don't wear one outdoors. But anyway, but McNeil is siding with this based on Fauci's kind of tilting towards this. And he did this in late February when literally 10 days before or fewer, he had said that coronavirus was just minuscule. So something happened in those 10 days to change his point of view. And nothing had happened in China. That was all kind of past. So something weird happened in those 10 days that, changed the world as far as our COVID response. But it wasn't science. And this good Fauci and, Mr. Hyde Fauci kind of showed up and took over for literally Dr. Jekyll Fauci.
Yeah, this particular case, of course, I think the more I look at these issues, the more I would like to develop a sequence of events. So, for example, I've been noticing. So there are. The question is, what came first? Did medical panic come first, or did the public panic come first? So we know for sure that once Fauci panicked, then of course we start getting more public panic in across the
Well,
world.
I'm only going to stipulate. I'm going to cut you off for 1 second. I apologize, but
Yeah,
I'm not sure he panicked. I personally think that they decided that there was a bigger virus than coronavirus. This is my conspiracy theory.
Yeah. No, you're right. See, there can be many reasons, and so we know about self-interest, and other things. So public
Right.
choice theory says that there's no doubt that these public health guys benefit a lot from panic and so on, which is one of the common themes I'm talking about as well. So if you go into details of my book 1, which is a separate, so my work is looking at public choice stuff, which is what you just mentioned as well. At the same time, what I'm trying to mention is that he is just one of the many things that happened in that period of time. There are, one of the common things that I'm finding is the doctors were busy writing articles everywhere from the very beginning, demanding this thing. So if you notice carefully here, Randall, you go back to the medical literature, the public health literature of the early 20th century. There's a vast amount of vast number of articles promoting lockdowns. Vast number of articles. Okay, and so what they're based on, they're based on models. So if you look at the literature starting from around 2001 and so on, that's the reason why Donald Henderson wrote this article in 2006 saying, don't do this. This is absolute rubbish. Don't even try it. But that's why he wrote this article. But essentially from 2001 onwards, there's a vast number of articles in public health promoting lockdowns.
Promoting lockdowns, really? Because they'd only been used. I actually looked in the history of it, and it's in this article as well. The history of lockdowns is actually pretty brief.
It's actually very interesting. It's basically been used in many different ways. So, let's talk of quarantine as a general concept. So, in the Spanish flu, there was a lot of.
I'm talking about lockdowns per se, not quarantine.
I get your point, but lockdown is nothing but a quarantine, mass quarantine, right? So, we've had mass quarantine in the past in many cases, particularly with Spanish flu as well, and with SARS in many parts of the world and East Asia, and also in Canada and so on. So it's not totally new though, the panic and the response. It's a continuation of the same thing that happened. But what I'm saying is the public health literature is flooded with promotion of quarantine and lockdowns in the early 20th century, number one. Number two, you see a lot of doctors holding the mic in the television promoting lockdowns in the early 20th, in the early period of the COVID pandemic. And you see lots and lots of doctors. I said 6,000 doctors, or 6,000 doctors in Australia wrote, I think, on the February 17th or some such thing. They demanded lockdowns, and there's so much medical promotion of lockdowns from the past 20 years, let's say, in the literature, that the end result is that Fauci might have been overwhelmed by something. I don't know what. We can't really say what made him into a hide. But what he did is he did change his mind. He just changed his mask or face or whatever. But remember, that same thing didn't happen to Anders Tegnell. So my general point still remains that unless the doctors panic, unless the lead doctors will panic and transmit the panic to the society, you don't get public panic. A good example is Fauci himself. If you go back to Ebola, during 2014, there was a lot of stuff happening with Ebola in West Africa. One case occurred in the USA. Then what happened, if you hear Fauci, he goes again and again on television saying, there's nothing to panic, and we don't want to quarantine workers who have come from West Africa, because that will stop people from going and fixing the problem in the first place. This is something completely manageable with our resources. He calmed down the USA in that period. You see Fauci. When the lead doctors are calming down society, there is no public panic. When the lead doctors are causing the panic, they themselves panicked, or as you rightly said, he might have seen some money at the dollars at the end of the whole process for himself. I don't know what it was, but we can't really know his mind. We don't know. What we do know is that this is a pattern. So I'm looking at patterns here, and that's why my dive is into history. I'm not diving. COVID is just one instance, in my view, of the patterns of panic across the world, medical panic. And in all cases, there is a problem. There is a genuine problem with the doctors. They are facing death suddenly. Doctors, by the way, as a rule, are more anxious and more depressed than the rest of society. This is something I wasn't aware of.
Present company excluded.
Huh? Sorry?
Present company excluded.
Of course, but on average, we're talking averages. The statistical average of a doctor, medical community, particularly doctors, that they have far more, they have many more mental health problems. They're far more prone to drug addiction than the average population. On top of this very, panicked kind of a mode anyway for many doctors, then this death suddenly comes at them. And they're now expected, they're thrown into the deep end. The medical staff has disappeared. Nobody wants to attend. There are these unknown situations with the unknown disease. They get really fear-stricken. So my view is that I call it the blue shift. The death is suddenly coming to them very fast. And so what they have is a sense of panic. And so my studies are in the second paper are mainly on panic. Panic has been ignored by economics, largely ignored. Now we do have studies on financial panics, but that's nothing like the panic in the face of death. And I think I'm going to be probably the first to study that. And what I'm arguing there is that the panic is justified. I'm actually defending doctors for getting panicked because the society doesn't really care for them. The society says, I'm going to give you the minimal resources. I don't want to give you one extra, room, ICU, nothing. I'll give you only so much because we economists are very brutal. We say, no, cost, benefit, cost. We cut down all extra facilities in the hospitals. We don't give them separate places for isolation. So you remember many of these hospitals converted into COVID hospitals. They basically said we only have COVID ward, this, that, etc. That's nothing but a separate isolation hospital system.
Mm-hmm.
Infection hospital or whatever we call this. These have been done in the past, so it's not new. But the point is that in each case, doctors are doing the best they can, given the fact that they may die any moment. So we got to look at it from their perspective, put ourselves in their feet. And I see why 6,000 Australian doctors, 6,000 is not a small number. 6,000 of them wrote an article demanding lockdown, shutdown. We say we can't deal with this. Read the letter. It's very clear. We can't deal with this thing. And that's 17th of February. So we are seeing, and this is, as I said, throughout history, doctors flee. They get away from the city. They don't go there, right? So what we do need at the end of the day, that's my third paper, is that I'm proposing a completely, massively overfunded system. What I'm saying is that
you're proposing that?
Yeah. So that's called an isolation hospital system. What I'm saying is that the cost of medical panic to society is $15 trillion. We've just seen that in the last 2 years or 3 years. That if they panic, the society panics, and we shut down the world, what we lose is such an enormous amount of money and such an enormous amount of health and other things that we just can't afford to do this again. My argument, and I've done some calculations, that it is so much cheaper to build a completely strong and surplus capacity with so-called surge capacity hospital system, which will separate the the seriously infectious from the others, will isolate the seriously infected, and will give these guys, the doctors, as many PPE as they want. And we see, and I've cited the examples of so many nurses and others saying, we have nothing of the sort, we have no material for our safe face and so on. Well, give them everything. My point is, give these guys, because they are the ones on which society depends, give them whatever they want. It's still much cheaper, much cheaper.
No, I think you got to be very careful there.
I'm being careful. Yeah, but go on. Explain why.
Well, the problems I would have, it's like petitio principii. I think it's begging the question.
Yes.
You would be incentivizing a bunch of people who would profit from their own dicta in extremis. So, or to put that in simpler words, they wouldn't have any disincentive not to exaggerate. And I think this is obviously not a good economic model. I mean, I think there's
on the other hand, can I interrupt?
Yeah, sure.
So here's my point, that if you give them this whole exercise, what is the common excuse you see across the entire newspapers all over the world? The health system capacity. We need to flatten the curve. I'm
glad you brought that. I've been thinking about that all along, that this was the reason they were closing down, was to flatten the curve. And yes, you're making that point reasonably well. But I think it's all begging the question. I think it's stipulating something that never was true. We have not had the zombie apocalypse. I mentioned that, if we had, aerosolized viral anthrax level illness, or a zombie apocalypse. They land and there's actual zombies. Then maybe we can talk about some of this stuff, but we don't, and we haven't. The coronavirus was not that. The data were there clearly in plain sight, and I bring this up again in my article. The Diamond Princess was almost literally a quarantine. It was 14, whatever 14 is in Italian. It's not 40, it's 14, whatever. They had the modern day version of a literal quarantine.
Indeed.
14, not 40, days out at sea. And that's how long they stayed there. People were not dropping like flies. I actually don't see flies drop that much, but they were living. And by the time that Fauci changed his mind in late February, there had only been, I think, 2 or 3 deaths on the entire boat of 3,711 people. I guess maybe a few hundred of them were crew, but mostly, it's a population that skews elderly to be able to afford to be on a cruise ship. So you have an older demographic than usual, but amongst the children, and none of the children even knew they had coronavirus. They were tested later, and the few hundred kids on board, none of them had any symptoms ever. Nobody under 20 had any problem if they did have symptoms. There was nothing going on with all the mobile staff in their 20s and 30s and 40s and so forth. Nothing. And again, after like 5 months, 10 people were died and was attributed to coronavirus. Probably only 2 or 3 of those are actual coronavirus deaths, because the mortality is within 2 to 4 weeks. And again, by mid-February, late February, Fauci would have known, because landfall in Hong Kong was January 25th or 24th. There was plenty of time to see that this was an actual thing, and he knew about Diamond Princess. Anyway, my only point here is about giving them everything they want, is that we see the exaggerations that happen. It's almost impossible to convince medical doctors, and I know a fair number of them, that this was not so bad an illness. They all talk about they know somebody's dad, and it gets anecdotally personalized, and people have a hard time seeing data as a physician.
So exactly, that's the point. When I talk about panic, Randall, I talk about irrationality, right? So we making what you're talking about is like a rational doctor. You're a rational doctor. I know that. That's why I'm talking to you in the first place. Rational people will not ever panic. Okay, no matter how serious the disease. Okay, so that's the different issue. My point is slightly different. That guy was called Clot Bay. His name was Clot Bay, the French doctor, who said, okay, this plague is not transmitting person to person. Let me take the pus and put it into my body and see what happens. And nothing happened. And he did it 4 or 5 times. So on the other hand, there are people who see the pus and they see the plague and they panic and they flee. So I'm talking about irrationality here. Okay, Randall. So when we say that these guys have a rational reason, they say flatten the curve because we are panicked. Well, I'm saying we'll remove your reason. You will not allow you to have a reason of flattening the curve. You will get sufficient that you will not be required to make that reason. Now, here's the thing. Here's the other thing that I'm saying. If you ever panic again, and if you ever put a lockdown again, you're not getting any of this. So it's got to be a deal, okay? It's a social contract. It says, we will give you a very strong hospital system, a really good one, okay? Much bigger, it's almost like, giving them a ransom for the terrorists. But what we're saying is, look, doctors, we understand that you panic. We appreciate that, we put ourselves in your shoes. I tried to do that myself. And I said, okay, maybe these guys panic. Maybe there's a reason behind it. And so what are the reasons? Let's solve those reasons. Now you got to commit to me that you will never panic again. And that you will not impose lockdowns and you will not do mandatory masks and all these other things. And then I will give you, a society, we should say, will give you all these things and well managed, etc. So look, there are economists will come in and manage that well anyway. There's so many ways to deal with that, but it's going to be 1/10, 1/20th the price of what we pay.
No, I appreciate the sentiment. I don't see it as a viable proposition for many reasons. All these big extra capacity hospitals would have to be manned and populated. Meanwhile, or else they'd be mothballed. But in point of fact, when the USS Comfort it's a ship, was brought into harbor in New York City early, I think it was March 2020, at the onset of the pandemic in the U.S. in the worst possible place. It was ignored.
I get your point. I'm asking you a question, Randall. Here's the thing. Ignore COVID completely. I'm not interested in COVID at all, personally. Okay, right. I'm saying what happens if it was bigger than Spanish flu? What would actually happen? So let's say that these guys panicked for a stupid reason. My question is slightly different. what happens if there is a real new virus, which is as bad as Spanish flu? And let me tell you that the system, we need to think in that line. We need to think much more broadly than simply COVID. I've moved on from COVID completely. Okay. I can see clearly where, and I'm looking at patterns. And as I said, the pattern of COVID has been replicated throughout history. It's not the first time. The more you read my work, you'll find, and I'm going and collecting more and more material, it is not at all the first time of the same patterns. Okay, so we are seeing patterns. And so what am I saying? Let's do pattern analysis, empiricism. I'm being an empiricist. If a doctor panics or a doctor panics repeatedly, if the system is not able to take care of them, then my answer is, okay, let's try to build a system which will not panic. And I can't stop humans from panicking. I really don't know how to stop doctors from panicking, okay? But I do know that I can try to make them feel safer. And so all I'm saying is we need to build a system that will deal not with COVID. Forget COVID completely. It's out of scope for me as far as I'm concerned. It's just one out of many instances. What is the general theory of public health? How much do we need to deal with negative externalities? And also, how do we deal with so-called positive externalities, which is my other work on vaccines and vaccine mandates. So I think we are, as I'm sorry to interrupt you twice, but I sort of have moved on from COVID completely. I'm not into COVID. I'm into general.
Yeah, no, I understand that. I wish people had your attitude. I saw people masking tonight. I was at a kind of an outdoor end of kind of harvest festival party, and some people showed up masked. Crazy.
And that's called panic.
So I wish they were beyond it. My own theory, my own article is that Omicron, I wrote this a year ago, Omicron is not even a lineal descendant of SARS-CoV-2. So I think you're right. SARS-CoV-2 is long gone, and it's not really an issue medically at all, and it's not coming back because everyone's immune. But I think if you look back at all these kind of health scares, fear and whatnot, they've mostly been castles made out of sand. They just wash away. I can't think of the last time a predicted pandemic was actually worse than the prediction. I don't know of a case. Maybe you can tell me. I know
there wasn't any such case, but there was a real pandemic in 1918. Okay, so that was a real pandemic of a very significant magnitude. So I'm actually looking at the Spanish flu as an example, and saying, okay, we can deal with plague and we can deal with bacteria, but we cannot deal with viruses that easily. And if some really deadly virus does come by, how do we deal with that? And that's my real question.
Okay, fair enough.
It's not COVID.
Yeah, no, I think that's a good question. I think that we have, there's two. 1918 is a different era. It's pre-vaccine era. We have not had an influenza of that type of severity. Although we have had H1N1, that was the Spanish flu influenza. There's, I think, 11 high-L urinidases and 13 or 15 neuraminidase. And so basically it's like a two-socket one-arm bandit, and it's going to come out H1N3 or H3N5, whatever. It's going to have a different version. There's about 35 major, more popular versions of the influenza, and they cycle and circulate over time. All well and good, but they run pretty much a narrow bandwidth of severity these days. They have a certain bulwark of the population which remains vaccinated, and they have some continuing exposure to previous influenzas, and the flu shots themselves have some kind of general aspects about the flu. So we have kind of a better baseline immunity to influenza than we had in 1918, which was only the hereditary type. Which actually kind of the inimical part of the Spanish flu is that the elderly did, for the most part, better than young people.
Yeah.
And I assume you understand that's because they probably had prior exposure 30, 40 years prior. If they're 67 years old, when they were 20, 30, 10, 15, whatever, they had that same flu and they still remembered it immunologically. So they were protected, whereas the 20-year-olds hadn't and they weren't. So I think on the level of immunity, we're going to have vaccines produced more quickly. And I'm not a big proponent of the mRNA vaccine experiment for COVID all being run out on the whole entire population. But that being said, it's going to be easier and faster, quicker to make the next one. So I think we have, evolutions in our response abilities. Additionally, we have they didn't have penicillin in 1918. So if you had the flu first, then you wound up with a pneumonia result, there was no way to treat it except, thoughts and prayers and whatnot. And we don't really have that problem today. We have much more specific antibiotics, and we're going to be developing other treatments. So I just don't think categorically.
So Randall, let's assume for a minute, asking, using your logic, let's assume for a minute that virus of the magnitude of Spanish flu, maybe a coronavirus or whatever, comes up again. This time is a genuine one. And now you need the ICUs to provide the antibiotics that you mentioned, because people have, millions of people have got pneumonia. You don't have it. So what I'm arguing is that, yes, by all means, consider all these things. I'm not saying don't consider all the facts. What I'm saying is take into account all this information that you said, and then build a system that will make sure that doctors do not panic.
Well,
and
fair
if we
enough.
can't do that,
I think you're hitting at an interesting point, and I'm not going to be able to answer that specifically.
Yeah.
But I will say this: that viruses don't have brains. Many humans might fall in the same category, but we react to viruses. Viruses are kind of passive. They're like the air, and they spread out. They're going to do their genomic thing one way or another. But I'm just going to put this one point out, which is that if you do have the zombie apocalypse virus, things that burn bright burn quickly. It's like a firecracker. It has big explosion and it's gone. If there's two methods of success, and they don't know how to succeed like the Kardashians or whatever. But if a virus is going to figure out it's going to succeed pretty much in one of two different ways. A zoonotic basis, that is, it has an animal host and it doesn't really need humans and can kill us off at will. That's the standard flu model. So they can come in, they're living in pigs and fowl and whatnot, birds, and they can come now and then and swoop down on the population and hurt us, and then they can incubate back in their natural, other animal host. And so those are dangerous and periodic. And the original SARS 2003 version is presumably a zoonotic coronavirus. And this one is essentially a version of it, but it left in the lab. Anyway, so the flu model and the Ebola model, and a lot of illnesses can come in from animal hosts. But if they're going to stay with humans, they can't keep doing that because we won't transmit. So Ebola, the example of Ebola, we're always worried Ebola is going to take over the world. Well, it doesn't, because humans react to cases of Ebola, and including the fearful doctors. So when Ebola burns, like that firecracker or sparkler, it burns so brightly, everyone stays away from it. And it doesn't wind up communicating. Everyone doesn't kind of fall over like bowling pins to Ebola, because we naturally stay away from, we have this natural quarantine concept of moving away from danger. So if there's an explosion on the street next to mine, I'm going to move away from it. Now, if there's an explosion on the next street, we're going to figure out what the pattern is and stay away from those things. And we adapt. So we're an adaptive species. We're not always brilliant, but we are kind of like globally brilliant in the sense that we have a wide, range of sensors out there, individual people thinking about things. So the coronavirus, it kept being talked about in various stages, the alpha, beta, delta, gamma, whatever variant strains. This one's even more transmissible than the last one. Meaningless. Transmissibility means that it's milder. In order for something to be transmissible, it has to be not killing the host. So the common cold is the most transmissible thing ever, but we don't worry about it. We don't have vaccines for it. We don't close society for the common cold. Although with Omicron, we're essentially doing that because that is a common cold coronavirus, of which this coronavirus has always been the second most common name cause of common cold.
So Randall, let me just get in once again. I think what you're saying is so rational and so sensible. It reminds me of Sunetra Gupta's point that we will never get good big pandemics ever again, and she's absolutely right. I'm absolutely in agreement with what you said. What you need to tell me at this point, and that you need to think about, how can you fix the human brain, which has evolved over the course of...
I don't want to fix the human brain. I don't want to fix it.
Well, here's the problem. You cannot make doctors rational. My argument is that you cannot make society and human beings rational. They have this limbic brain. Once they panic, and there are so many ways to panic nowadays, social media, blah, blah, blah. And so there's a lot of literature on panics, okay? But what I'm saying is that you can't fix panic.
No, I understand. Let's get back to our friends the libertarians. The old expression is, you have the right to swing your arms around until it reaches the tip of my nose. Yeah. And so, to a certain extent, I don't smoke cigarettes, okay? I don't drink a lot of booze. I don't do drugs. I don't do this. I don't do that, whatever. But the people who do, they're not necessarily bothering me hugely. And if as long as they understand the risks, I think they're willing to take the consequences.
You're being rational again. You're being very rational again. Tell me about the irrational doctors. What about 95% of the population of doctors?
Yeah. No, it's only 90. Listen,
you mentioned yourself that today your colleagues don't agree with you that coronavirus was absolutely like the flu.
I understand. I don't know what to do. I don't know.
So tell me, if you can't fix your fellow doctors, how can you fix the problem of social panic? I'm looking at panic as the issue rather than the actual.
I think that's wise. There's a joke. It's only 90% of lawyers that give the rest of them a bad name.
Yeah, we have a problem at hand. I'm struggling with that because I can't see how rationality can fix the problem at all, because people I found are dramatically irrational.
Okay, so let me answer that question then. I try to find silver linings where I can amongst clouds, and a few silver linings of the COVID era. One of them is that the religious people were more rational. I think they were more wise, maybe if you don't want to use rational, in figuring out their life choices. So there's Keynesianism. You're an economist. Many people feel that Keynesianism suffered from John Maynard Keynes, that his homosexuality, non-marriage, no kids status changed the way he looked at the world, and he wanted a short-term fix. They want short-term stimulus, infusions, so forth. The religious amongst us actually had kind of an opposite viewpoint of coronavirus. They did not want an immediate fix. They wanted to live life. They understood their spirituality was more important. They're getting together in worship was more important than getting a cold or whatever. Can't remember the name of the islands. The Faroe Islands were written about, a part of Denmark. But my friend in Iceland, Thorstein Siglausen, also writes for Brownstone. He had a piece on the Faroe Islands, and they're basically kind of a quasi-republic because they're so far away from everything else up in the North Sea someplace, I think between Iceland and Norway. And they have, I don't know, let's say 30,000 people on the island or whatever, a few different islands. And they're it. Nobody else is coming. And so when coronavirus came, they were told to lock down, shelter in place, blah, blah, blah. They're like, we have only each other. It's a desperate, dark, dismal, dreary place here in the Faroe Islands. We got sheep, we got darkness, we got cold, we got winds, and we have each other. We live by song, we live by stories, we live by looking at each other, we live by going to church, we live by the life we have. And if coronavirus is going to come and take some of us, that's what we're going to have to do, but we're not going to sacrifice our lives for that. And so I think there, in some aspect, there was a religious moment, whether it was, specifically from, their churches or not, I don't know. But many people, I think there was a guy, John MacArthur, out in Los Angeles, who insisted, despite fines and whatnot, huge fines, $100,000s of dollars fines, insisted on having church because he felt that people's spiritual needs, preempted their safetyism needs and so forth. And that, people live, people die. And if your life is not just bonded solely to the material, that you will have a different perspective. So, I don't think you can infuse or inject religion in people, but I do think there's a reasonable pause that insofar as, people can understand kind of the essence of life and humility, they can maybe do better. I didn't have a problem with my mother-in-law. She lived in our basement through the last decade or so. She passed not from COVID, but afterwards, totally, just old age things. She could have had as many vaccines she wanted. She wanted all of them. But, people, I don't think she wanted them for her grandchildren. And I think people need to have a kind of a reasonable perspective of what life is. And I think they lose that. And especially they lose it during the lockdown period when they have, the most tenuous of connections with everybody else. So I think the example of the Faroe Islands is a reasonable one. I recommend the article. I'll try to put it up as a link. But I'm trying to leave on something hopeful here. And I think that, we didn't see that in places where people are kind of more, I don't know what your equivalent in the New York Times is, but where people are more New York Times, CNN, MSNBC based. They tend to be much more jittery. I think they have much more of the mental illnesses you're talking about. They're not genuine, horrible mental illnesses. I think they verge on anxiety and depression and lack of sleep and over caffeinated and over drunk and over drugged or whatever. So they're up and down on the basis of their various perceived needs. And so they're missing some of the spiritual part. Anyway, I'm going to kind of leave the last few comments for you before closing out our little bit more than an hour.
Well, I just take a second to sort of refute your argument that there is a solution in religion or humility and people getting sensible, etc. So that's the argument I'm making. First of all, religion. The Pope himself was the greatest panic monger that you can imagine. The entire Catholic Church was panic mongering. In Australia, virtually all the churches, except one or two people I know personally, all of them panicked and all of them promoted lockdowns and mandatory vaccines. They said it's very ethical to do so. So first of all, religion cannot be a solution. I'm looking at it very objectively, right? So I agree with you that if you have those qualities, rationality, spirituality, then you're fine. But you don't. And that's what I'm trying to argue, that most people don't have that quality.
No, I agree with you there. No, it's hard to argue with you. You're very comprehensive and thoughtful.
And that is why I believe in systemic solutions. I'm looking at a policy answer to this question. I'm not looking at a idiosyncratic thing which can work in one island here or one something there. It has to be global. I'm looking at global causes, global patterns, historical reasons why. So I'm actually paying attention to what panic doctors are saying. I'm reading the letters that they've written. The 6,000 doctors of Australia wrote in favor of lockdowns. I'm reading carefully what they're saying. I'm reading the other things that doctors have said on television. Lots and lots of doctors came on television and CNN and others. Sanjay Gupta, whatever his name, and panicked everybody, right? So I myself have heard that guy personally. And so there are lots and lots of doctors. There's another guy, I forget his name right now, and I bought his book recently. And so there's a doctor who actually wrote against panics, and he himself panicked. Okay, I think Mark Siegel or something like that. I forget his name. I'm sorry about if I mispronounced his name. So what I'm saying is, doctors panic. It's a law of nature. It's not linked with it's not linked because they're doctors, because they're facing death at a faster rate than anybody else, or they perceive themselves as likely to face death at a faster rate. So there are very objective, genuine reasons for them to panic. And I'm saying I will remove those objective, genuine reasons for panic, and that can be as efficient as possible. But the current system is not sustainable, and it will create panic out of nothing. So the COVID was a panic out of nothing. But if these guys had the surplus capacity, they could not make us panic because they could not give the excuse. So anyway, that's my argument. I will simply close here. I'm happy for any refutations of my arguments, which are all in the public domain. I'm also looking at vaccine mandates, and I'm demonstrating that most ethicists, most economists, and many others, have been completely wrong in promoting. Vaccine mandates are more promoted in the literature than even quarantine. So while quarantine is widely promoted in the public health literature and health economics literature, vaccine mandates are almost like a guarantee. It's almost guaranteed that almost 90% of the books are going to promote it. So the students who are coming out from public health. So my question is, I'm not at all interested in what happened in COVID, because this is just one example. I want to fix the textbooks. I want us to look at the textbooks very closely and see what we're teaching our children. And we teach them wrong things.
Good luck with that. I was at the national meeting of the American Association for Public Health, and it was at a hotel in Boston. And one of my old professors, whom I greatly loved, was there, and he's now in his 80s. And we wound up talking. This was January 2023, and every single person was masked indoors and outdoors. Every one of these MDs, MPHs, and all that kind of stuff, professors, PhDs, they were all masked all the time. I'm like, okay, this is the group. These are the minds behind all the public health articles, all the public health, initiatives and so forth, and they have no clue about the actual virus that they're dealing with. It's a group thing. And
so what happens here when people like Anders Tegnell or Stephen Barral, they say that we have been taught all these good things in the past. I'm saying that they're wrong. The actual literature is completely opposite of what they're saying. The literature is very much totalitarian. It's promoting lockdowns, it's promoting quarantine, it's promoting vaccine mandates, it's promoting mandatory masks. That's the literature, okay? So if you are then surprised that these guys are doing exactly what you told them to do, that's your problem.
I wasn't surprised. I was saddened.
No, so my point is that initially I thought, and this was my mistake, I thought that the people like Anders Tegnell said, publicly, hey, we learned so many things, we've been taught all these things, and so what's happened? People have forgotten everything. Stephen Barral says, we never had a lockdown lecture. I'm sorry, both of you are wrong. Your books are full of lockdown promotion.
Okay, so I'm going to just give you slight pushback. I don't, because I think conflating the term lockdown with quarantine is a mistake. Lockdown is taking the healthy population and keeping them locked in like a prison. So basically, it was only used, if you look in Google, it's only used as a prison term until very, very recently. There are only 2 instances of lockdowns in public health prior to COVID. One was in South Africa. This both in the 2000s. One was in South Africa in this tuberculosis hospital, and they had a particular, antibiotic-resistant strain. I think it's called the Jose Pearson tuberculin hospital. And the other was in Sierra Leone during Ebola. And that was only for 3 days, and that did not, and it had a religious exclusion, specifically if you needed to go to mosque or church, you could go for as many hours as you want and come back. So it was a very light lockdown, as it were, and it was only 3 days, and that was that. And that was for Ebola, which is, pretty interesting illness by itself, but 3 days. And I don't know if that was to flatten the curve or whatever. So there have been no actual cases of lockdown on a populace, and certainly not on the entire earth, such as we did, and not for respiratory illness, etc.
Which leads into the other point that I make, that panics are increasing over. If you look at the history of panics, they're actually increasing, and I've given very strong reasons why they're increasing. When you have only have 2 children, you're likely to panic more than when you have 7 children, and so on. So I've got lots of reasons there why panic levels are increasing. Mm-hmm. But lockdowns are basically mass quarantine. I can go back into history and, I can actually elaborate on this in my paper 1, why I believe lockdowns are the same as quarantine. They are just a different version of quarantine. But the point I'm making is slightly different. I'm saying that the literature is flooded with this promotion. There is no mention of Charles Maclean. There's no mention of the fact that the sanitarians opposed quarantine. And that, I think, has to be fixed. If you don't fix that in the public health literature, and I agree with you that that's difficult. But
what are the odds we could get your article into the American Journal of Public Health?
0. I don't think any. Luckily, for example, the BMJ, for example, Global, they actually published one of my articles with Gigi Foster, which is against the Australian lockdowns. I was surprised they did so. And they actually tweeted about it as well. They tweeted that article. I'm very surprised. Look, we never know that the world might change, and they want to listen to reason at one stage. Yeah. But I'm not holding my breath on the fact that humanity will suddenly become reasonable. I
would like you not to hold your breath. So I'm going to close out with, because I'm here frankly because I love talking to you, and if you held your breath,
I think we better close it today. Yes.
All right, so I'm going to show people a picture of your book. You probably have others, but this is one I have up from last time, The Great Hysteria in the Broken State. Let's see, as author, what else we have here.
And the other one, I think, do they have, no, this is not the one that you'd be interested in. So the other one is the cost-benefit analysis with Gigi Foster. Look, people, if they go to my, search for my name, they'll get a lot of material. So that's
I can't pull that all up at once. But
don't worry.
You're on Twitter right here, just the last name. So people recommend people follow you. And let's see, where's your page here? I had it up a second ago. What did I do with it? Oh, here. No. Okay. I'll come right back to it. Let me just end with a little bit of my own self-promotion here. This is my book, Overturning Zika. If you want to help support my video cast, my podcast, you can buy this book. It's on Amazon and also here on Barnes & Noble. For the very same price, you get a picture of me on the cover. And this is about speaking of pandemics and fear. This is literally the pandemic that never was. Zika microcephaly in Brazil, 2015-16, and caused a lot of upheaval there. People might have forgotten already, but they shouldn't, and I hope they remember it. So that's pretty much it. I was hoping to show your webpage. Oh, here we go. And here's one of your The Ugliness, Evil, and Impossibility of Public Health. And I think, you're a fascinating man. You are articulate. You make your case very thoroughly, and I want people to follow you and learn from you.
Oh, thanks for the praise, Randall. I'm just doing what I think is necessary to understand the issue. I'm completely flabbergasted. Personally, I could not be more, completely away from where I was at one time. I was in great praise of Australia, the Western world, and so on. And then suddenly everything has changed. So I'm trying to figure out what happened. Why are we like this? What's going on? So it's all my, I deserve
Well,
nothing.
you have a great curiosity. So I think this keeps, there's two categories of people who fall into categories and people who don't. But seriously, I think the world is divided out. I went to school. I went to smart kid schools. I went to kind of an elite prep school, and then I went to great college and medical school and all that kind of stuff. But I think over time, I've been to my reunions, and the world pans out in people who continue to learn and people who are happy to get their degrees and then just kind of, stop. And, I think you have a boundless curiosity, and I wish you all the power and good fortune that should accrue to you, because you are willing to look at things and frankly, at the first principles, which is an important way to dissect these things. So I'm going to call it a day on this. Thank you so much. You and I can chat for a minute. We're going to say goodbye to everybody else.